Most surgeries take about 2 hours. Now this will feel like longer to your companions because there'll be time spent going to sleep and waking up. While you're asleep, you'll be fit with a sling. And after surgery, I'll go over the results of the surgery, your images, as well as your post-operative instructions with your companions. Our nurses will care for you for about an hour or two while you wake up in the recovery area. If you've been booked for a same-day surgery, you'll be discharged at that time with specific instructions. Your post-operative medications will be waiting for you at your selected pharmacy for either pickup during your surgery by your companion or on your way home. Please review my education materials and your discharge paperwork. They're designed to keep you on track. Pay particular attention to your restrictions and my post-operative pain protocol. Remember, rest, ice, and elevation are your first line defense against pain. You should ice 20 minutes every hour while awake. I provide a carefully selected pain regimen designed to optimize your experience. This includes Tylenol, an underrated pain medication, gabapentin, a nerve medication, Toradol, a high-strength anti-inflammatory, methocarbamol, a muscle relaxant, oxycodone, a narcotic pain medication, Zofran, an anti-nausea medication, and Senna, a stool softener designed to be taken as long as you need narcotics. The Tylenol, gabapentin, and Toradol should be taken as directed on the label. Tylenol, with or without gabapentin, should be taken as long as you have pain. This can be a month or even longer. The next line of defense is methocarbamol, and this should be used as needed for spasms. I do provide narcotic pain medications to be used as a last resort. You should plan on using these sparingly for up to 2 weeks. If you elected to have a nerve block, please be reminded that your pain will kick in rather quickly at some point on the evening of surgery. I recommend that when you arrive home from surgery, you initiate your pain regimen in order to stay ahead of the pain. Sleep can be a major and unexpected problem after shoulder surgery. As a general rule, you'll increase sleep in 1-hour intervals every month after surgery. For instance, the first month after surgery, you'll sleep in 1-hour intervals, and the 6th month after surgery, you'll sleep in 6-hour intervals. I recommend taking your methocarbamol and your gabapentin in the evening, as these can be sedating. Surgery results in swelling, which contributes to your pain, stiffness, and scarring, all of which slow your rehab. For shoulder surgery, I recommend sleeping upright in a recliner or propped up in bed on pillows until you're able to sleep more comfortably. In addition, if you have swelling tracking down your arm, I recommend a compressive sleeve for the first 6 weeks. This will be offered to you in my clinic or can be purchased commercially. While I appreciate close observation of your post-operative restrictions, I also ask that you come out of your sling 3 times a day to work on range of motion of the surrounding joints and for hygiene. This motion helps prevent stiffness in otherwise normal joints and pushes fluid out of your arm, preventing swelling. In addition to the elbow range of motion exercises that I provide, I'd like you to come out of your sling and work on wrist and finger motion. You'll be seen by myself and my PA at routine intervals. Your therapy will be advanced over time. At the 2-week visit, we'll check your wounds, we'll go over your restrictions and your results from surgery, and fill out any paperwork that you may have. Ideally, later that day, you'll have your first therapy visit. And sometimes, rarely, we may need to provide refill medications at that time. We then see you at 6 and 12 weeks from surgery to go over your progress as well as update your therapy and restrictions. Your diligence with your restrictions and your participation in physical therapy are undeniably the keys to long-term success. Remember, therapy is not a place you go, it's a thing you do. This is your full-time job now. You and I will draft a plan for your gradual return to work. While most patients benefit from 2 weeks off of work, it's not mandatory. You can return to desk work as soon as you're up to it and off of narcotic pain medications. But remember, you can't drive safely until 6 weeks after surgery. When it's appropriate, I'll advance you to light duty with restrictions, and most patients return to full unrestricted duty around 6 months. We do everything in our power to make your recovery as smooth as possible. Thank you for your commitment to the rehab process and for trusting us with your care.